Hello, my name is Owais and I will be presenting our scoping review on the assessment of brain function and plasticity in cerebral palsy using functional near-infrared spectroscopy. Cerebral palsy describes a heterogeneous group of individuals with early brain injuries who show diverse clinical outcomes. The relationship between brain injury and functional outcomes in CP is inconsistent due to the complex interplay of neural injury factors, genetic makeup, and experience-dependent neuroplasticity. Functional neuroimaging can provide insights into brain behavior relationships in CP, both through brain activation profiles and functional connectivity maps that reflect synchronized activity across different brain regions. Functional neuroimaging involves trade-offs between temporal resolution, the time scale of brain activity, spatial resolution, the localization of brain activity, and the amount of movement that is allowed. Conventional scanner-based tools like functional MRI, magnetoencephalography, and PET scans offer high resolutions but are expensive and require fixed positioning. Conversely, EEG allows freedom of movement and provides high time resolution but is a noisier and less localized signal. An alternative modality that offers both good resolution and free mobility is functional near-infrared spectroscopy, or FNIRS. FNIRS devices use near-infrared light of specific wavelengths that can pass through biological tissues. Here is a simplified illustration. Near-infrared light passes through the scalp connective tissue, is scattered and absorbed before being reflected out to be captured by detectors. Decreased intensity of captured light can be mathematically modeled to estimate changes in hemoglobin concentrations. These changes provide indirect measures of brain activity. Importantly, due to the loss of light from scattering, FNIRS can only estimate brain activity in the outer rim of cerebral cortex. This review aimed to map the use of FNIRS to assess cortical function, connectivity, and plasticity in CP. The study protocol can be accessed with this QR code. Briefly, we conducted a systematic search of 4 databases using relevant search terms. We included empirical peer-reviewed studies that used FNIRS in individuals with CP older than 3 years. Studies in infants and toddlers were excluded due to the likelihood for incomplete brain myelination at this age. 16 studies met inclusion criteria. Most studies were based in the United States, with all studies published in the past 15 years, with an increase in publications in the past 5 years. Studies were consistently underpowered, with most studies including fewer than 10 participants with CP. 4 major brain regions of interest were assessed. Activity in the superior parietal lobule during treadmill walking was increased in children with bilateral CP compared to controls. Greater activity was related to more variable gait, suggesting impaired sensory-motor integration during walking in CP. Sensory-motor cortex activity was assessed during ankle dorsiflexion and asymmetric squeezing tasks. Greater activity was seen in CP compared to controls for both tasks, with higher activity related to worse selective motor control in the respective limb. Activity levels scaled with greater functional impairment, being greater in those at GMFCS and MAX level 3 compared to those at levels 1 and 2, who were more minimally impaired. Dorsiflexion activity was greatest in those with bilateral CP, while activity during the bimanual task was greatest in those with unilateral CP. Prefrontal cortex activity in CP was task-dependent, with suppressed activity observed across all levels of a physically challenging progressive lateral step-up test. PFC activity also decreased from baseline after a robot-assisted gait training intervention. In contrast, PFC activity was greater in CP than controls during a shape matching task, and activity was further increased when children were seated on a therapy ball and was related to worse dual task performance in CP. Interestingly, following intensive constraint-induced movement therapy, PFC activity in CP decreased to levels comparable to controls, hinting at its potential as a biomarker for functional improvements. Functional connectivity within the motor areas was also assessed at rest. Children with CP had greater frequencies of connections to the supplementary motor area that mediates the planning of complex movements. Following constraint-induced movement therapy, functional connections in CP decreased to levels comparable to controls. However, connectivity reverted to pre-intervention levels at 6 months follow-up, highlighting the acute yet transient impact of the intervention on neural connectivity. Resting state brain activity was also assessed, with the motor cortex in CP showing heightened activity compared to controls. However, during an active assisted arm cycling task, functional connectivity between the prefrontal and motor cortices was decreased in CP. This could contribute to the exaggerated cognitive motor interference that is characteristic of this group. In summary, our review found FNIRS to be safe, feasible, and sensitive at detecting and tracking brain changes post-intervention in CP. We also identified the lack of reliability assessments, consistently small study samples, and inclusivity challenges with poor signal quality in individuals with darker skin tone and thick hair as potential limitations. Notably, FNIRS-based neuroimaging in real-world settings remains largely unexplored in CP, providing exciting opportunities for future researchers. For example, FNIRS is well suited for brain-computer interfaces that can enhance functional independence in more impaired individuals. FNIRS can also capture brain activity across multiple individuals at the same time to better understand how children interact during play, or investigate how parent-child interactions can impact therapeutic outcomes. We explore these topics in greater detail in our manuscript at the Developmental Medicine and Child Neurology Journal. We thank our collaborators and team members and the NIH for their support. Thank you for your time.